Hello friends, welcome back to yet another video on Dr. Stocks. So this video is going to be really very important, as in this video I will discuss about many common mistakes which usually a student do while choosing any DNB institute. So we will deep dive into the mistakes and I will share all my experience of 4 years of observing Neet Pg and DNB and MD medical counseling. So without further wasting time, let's continue. So before going ahead, please like, share and subscribe this channel because I am sharing very important insights about the counseling, so that will be helpful for everyone. First common mistake which usually students do is to ignore the reputation of institute, because the reputation of institute is usually associated with the number of cases the institute get and number of good faculties institute has. So a reputation is directly proportional to good faculties and good amount of patient exposure and hands-on. So please don't be in a hurry to grab a seat early. Please always look for the good reputed institutes. Second point is to always inquire about academic exposure and hands-on of the institute. Yes friends, these 3 points are really very important. So always beforehand please inquire about these 3 topics, because if you have done your DNB from an institute where exposure is really very good, you must have already have acquaintance with all the cases, so you will not face any fear during the examination. And the hands-on should be good, because in most of the higher end corporate institutes, hands-on is not really very good. They will not give you surgeries very easily, they will not give you procedures very easily, so it will be difficult for you to match up with the AMD candidate to do the procedures after passing out the DNB examination. So always consider this point. Third point is not to contact any senior or alumni from that institute. Yes friends, I would like to say an important point, that you should contact the alumni from that institute instead of senior, because senior might give you some wrong information because they want their juniors, but a freshly passed out alumni from that institute will give you real insights from, because they are not having any personal benefit if you will join the institute or not. So please try and contact an alumni from the institute. Another common mistake which usually students do is to consider that if an institute is good, then it must be good for all branches. Friends, trust me, this is not the case. Each and every institute must be inquired for each and every branch you are interested in, because different institutes are good for different branches and different institutes are good for different branches. In many of the corporate hospitals, for example Gangaram in Delhi, it is really very good for medicine and pediatrics, but I don't think it is that good for surgical branches like orthopedics and surgery, because hands-on given there in surgery and orthopedics is not that good. So for this you need to inquire about each and every branch you are interested in about different institutes. Another common mistake is that students used to take DNB just for the sake of doing post-graduation. Friends, this must not be the case. If you are doing a DNB in any branch, then trust me, in that branch you must have your heart on, because if you are doing DNB from any branch in which you are not interested in, then it is going to be really very difficult for you to pass. Another common mistake is that people are always inquiring about the stipend. Friends, trust me, stipend should be the last thing you should inquire about, because before the age of 30 and while doing post graduation, you must always think to learn, and after the age of 30, after your post graduation, then it's time to remove L from learn. Then you have to earn. Okay. Another common mistake is to prefer location over the college. Friends, location doesn't matter. It's a matter of 3 years. If you are always worried about the location, then you might get an institute in a far away location near your hometown in which you are not getting any exposure, you are not getting any academics, you are not getting any cases. So it will be really very difficult for you to pass the examination. And another common mistake which usually students do is to not inquire about the toxicity. And you must know that seniors doing DNB from there will not tell you about the toxicity because they are facing that. So you must inquire about the toxicity from the colleagues, from the other departments, or from the other interns or non-academic JRs from the institute. They will tell you about the toxicity, they will tell you about the ground reality of the institute. So I hope you will like this video. If you are liking these informative videos, please like, subscribe and share this channel. I am doing this only to help you all people, so that you will not face any difficulty which I faced 3 years ago during my time. So please like, subscribe and share this channel. I will see you in the next video, and in next video I will come up with more such interesting topics. So I will see you in the next video. Till then, myself Dr. Nishant signing off. Stay blessed.